Tansy, welcome to the 20th Annual Speaker Series presented by the Indigenous Law Students Association at the University of Alberta Faculty of Law. Thank you all for coming. My name is Justin Helsvold. I am a second-year Métis Law student and chair of the Speaker Series Committee. First, I'd like to respectfully acknowledge that this meet is being hosted on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. We would like to thank all members of Treaty 6 for attending, as well as the elders who are with us today. And finally, we'd like to thank the Faculty of Law, the Alberta Law Foundation, and Rising Youth for their support. Each year, we devote 5 days to discuss legal issues affecting Indigenous peoples in Canada. This year's topic is Indigenous perspectives on the last year. It has been exactly a year since this faculty was all together. In the meantime, Canada's Indigenous community has shown inspiring resilience and legal acumen in the face of incredible challenges. Challenges to our rights, health, water, land, and livelihoods. You've seen it in the news. This is our side of the story. The COVID pandemic has presented us with an opportunity to see how Indigenous sovereignty is expressed. We welcome our speakers today. We're joined by Reagan Bartel, who earned her Master of Public Health and Bachelor of Science in Nursing at the University of Alberta. She has 16 years of critical care nursing experience delivering frontline care in an Edmonton ICU before moving into population health as the Director of Health for the Métis Nation of Alberta. Her focus is on ensuring that Métis stories, experiences, and perceptions gifted to the MNA are incorporated into health advocacy, policy, programs, and services. Bonnie Healy is a registered nurse from Kainai Nation. Bonnie's professional background is multifaceted. She's worked in numerous health capacities at the local, national, and international levels. Actively involved in her Blackfoot Ways of Knowing, she is the former executive director of the Alberta First Nations Information Governance Center. She is currently the Blackfoot Confederacy Health Director. Bonnie fulfilled the role as chair for the First Nations Information Governance Center from July 2017 to August 2020. Her work identifies priorities to support the recognition of First Nations jurisdiction and governance in the collection and use of First Nations information and data throughout various research initiatives. We had invited today Dr. Danielle Ben Smith. I assume that she is running a little bit late. However, if she's not able to meet with us, we give her our thanks anyways. The presentation will be about half an hour to 40 minutes. We're going to give each speaker about 15 minutes with a question period afterwards. Please use the Q&A function at the bottom of your screen to pose any questions that you might have. The session is being recorded. By participating, attendees acknowledge that photos and videos will be taken of the event. And now to start us off, Reagan Bartel. Reagan?
Hello, I'm just going to take a second here to get my screen shared, and then we'll get going. And we'll just look for confirmation from you guys that you can see what is on the screen. Okay. So thank you for the kind introduction, and I just want to firstly welcome everybody to this amazing initiative. I think it's so wonderful that the law students are taking the initiative to gain a deeper understanding of some of the strengths and challenges that are facing, the diversity of Indigenous peoples across certainly our province. I am, so proud to be able to present this on behalf of my community. So thank you very much. for the kind introduction. I am a proud Métis woman on my father's side. We descended from the line of Ignace Patras, and on my mother's side, we're deeply Irish, so she's a Fitzpatrick. I would like to acknowledge that I do live and work within Region 4 of the Métis Nation of Alberta, which is also home to a diversity of First Nations communities, part of Treaty 6. So the reason we're gathering today, or at least my goals, is to share you with a little bit of context around the pandemic experiences of our community. I'm going to touch very briefly on our history and identity, as well as our health status, just to kind of set the stage before we move into our pandemic experiences. So the reason I'm doing this is because I don't actually like to assume that folks are familiar with who the Métis are. That is one of the challenges that we face at all levels and all tables that the Métis sit at. So that's why we're beginning with a very abbreviated lesson on who we are and where we come from. And the purpose of this is not to give you an in-depth understanding of our history and culture, because I think there are many places that you can go individually to find that information, but you can certainly follow up with myself if there are requests for specific reading materials. So with that being said, the Métis are one of 3 constitutionally recognized distinct Indigenous peoples of Canada. Our culture originated from the Union of European Fur Traders and First Nations women in the 1700s, and descendants of these marriages formed a distinct culture, collective consciousness, and nationhood in the northwest of Canada. So it's really important to understand that our identity is one of the specific challenges that we face from a legal and jurisdictional standpoint. It's also important to really understand that we are distinct from First Nations and Inuit people. Métis were dispossessed of their land due to colonization, similar to our other Indigenous peoples in Canada. But our communities face challenges that are a little bit unique in that oftentimes we survived by being invisible. The reclamation of our identity is part of our political journey, and it's often very diverse and a very personal journey, and one that has not been really captured in any sort of programs and services that are Indigenous. And that is one of our roles over here at the MNA. There's a common misconception that Métis are, and I hate to use this word, but it's often used, so I'll put it in quotations, quote unquote, half-breeds, and that any intermingling of, Caucasian, European, and First Nations people are what constitutes a Métis person, and that's just simply not the case. Métis does have a distinct homeland, which is centered around the Red River, and it was in this homeland that our unique culture, laws, language, and traditions were born. We adopt the national definition of Métis, so that is someone who identifies themselves as Métis, is distinct from other Indigenous peoples, and has that connection to our historical Métis homeland. I think it's also really important to understand that the Métis were instrumental in the founding of the province of Manitoba, and our contribution to the expansion of Canada through the fur trade is one of the reasons why we are such a passionate and political people. Our experiences with colonization have created many of the same traumas that our First Nations and Inuit peoples do experience. However, we have some unique traumas associated with the method of displacement from our land. So scrip, which I encourage you to learn more about, was one of the biggest land frauds in the history of Canada. We've also been consistently traumatized through being invisible in all levels of policy, services, and programs. And we're still struggling with that, though we have made some headway. So just to give you a little bit of context about the MNA, we are the representative voice and governance structure for Métis in Alberta. So since its inception in 1928, that has been our role. We span the entirety of the province, which we divide into 6 regions, which you can see on this slide, and nearly a third of the 115,000 self-identified Métis Albertans are citizens of the MNA. The Métis Nation does have signed framework agreements recognizing, nation to nation negotiation abilities with the province of Alberta and with the government of Canada, though these are fairly recent, with the self-government agreement being signed in 2018 with the government of Canada. It's also important to note that there are some distinct governance considerations within the province of Alberta. I'm sure that there are people here who have heard of the Métis Settlements General Council. They they are separate from the M&A, and the MSGC is responsible for the provision of services on settlement, while the Métis Nation of Alberta focuses on the off-settlement citizens. So that's just a little bit of our history. And now we're going to get into the good stuff, the COVID-19 context. So health data, it's really important to understand that health data does indicate that Indigenous people experience higher prevalence of conditions that increase the risk for severe outcomes related to COVID. And our Métis-specific health data supports this. One of the challenges we face related to jurisdiction and inclusion in COVID programming is proof. And so the Métis Nation of Alberta is really fortunate to have an information sharing agreement that recognizes our sovereignty over our data, and we are able to link health data in order to give us the information that will then support this COVID context, essentially. Jurisdictional challenges are certainly real within our Métis context. We sit at many tables where services are potentially provided for our First Nations relations and may not flow over into inclusion of Métis people. So it is a jurisdictional nightmare still. This is just kind of for interest's sake. I know you guys may be familiar with this data from the regular provincial updates associated with COVID-19, but I just wanted to highlight that this is our Métis specific COVID dashboard. So from our community, roughly 3% have been impacted by COVID-19, and sadly 8 families are grieving the loss of their loved ones. And so what's really important to understand about this data is that there's a high likelihood that this is an underrepresentation of the impact that it's having on our community. Many Métis people do not feel comfortable within the existing health system due to challenges with systemic racism, discrimination, and so they choose to not access health services even when they potentially should. And so while 3% of our population has gone and gotten tested, I would hazard to guess that there is a lot of our community that just does not feel safe. Our COVID response for the Métis Nation is kind of driven by 4 main areas. And so communication is our first point, and there have been real challenges around dissemination of information related to COVID-19. And while there are diversity of experiences within our community kind of related to all levels of government, there is a noted distrust of kind of the colonial government, so whether it's the province or the federal government, and their messaging around COVID-19. And so this distrust has the potential to put our community at risk. And so we've been working really hard with our partners to ensure that we have up-to-date information that we can then disseminate, because it is important that we have, self-determination and are a trusted source for our source of information for our community. So without that, we run the risk of not being able to communicate, information about the disease, its transmission, the vaccine, or any of those other public health measures. So we're working to build trust. It's an ongoing process. The M&A, like other communities, also has had to combat social media and the infodemic that is ongoing related to COVID. And so we are facing those challenges, and we face challenges particularly with connectivity. So a lot of the information, obviously, now that you can't go face to face or have bulletins going around, a lot of the information is over the internet. And we do know that our northern communities in particular are challenged with connectivity. And so we've been working with partners to try to address that. I think it's also important to highlight successes, in terms of our youth, because our youth has stepped up and are providing, kind of that communication support to each other, which is lifting our community up. And I think that's an important piece to remember within the Métis community. A social determinant of health for us is a really strong social connection and kinship ties. And so we are lifting each other up through the various groups that we have internally at the M&A. Advocacy is a huge piece of our COVID response. So at all levels, at all tables, the challenge that we're facing is that we're still not really part of the decision-making table. So we've not received allocations for vaccines. We're kind of lumped in with everyone else. Initially, our urban Métis were not included at all. And that is similar with our urban First Nations and urban Inuit people. And so we've collectively come together to strengthen our voices at urban tables. And as a result, Métis in Alberta have been included in the phase 2 rollout of vaccines. But I want want to highlight that even that has not been smooth across the country. There are jurisdictional challenges. The concept of the federal government receiving the vaccines, giving it to the provinces, and then the provinces having jurisdiction over the allocation and delivery of those vaccines has caused a few bumps. And you can look to provinces like Manitoba, who have spoken out quite publicly about not being able to access vaccines for their communities. So we're fortunate that this is not the case in Alberta. We have been included in the prioritization, even if we haven't been allocated specific vaccines, which we're still advocating for. I think it's important to recognize community-driven supports. Our Métis experiences are shared at a community level, and regional leadership was provided funds to address those concerns at the community level. And so I think that that is a very important distinction between some of the actions that have been taken, you know, kind of by a more colonial government versus a Métis-specific government, recognizing that communities need to have some autonomy over how they support each other. And that's just, you know, our Métis way of being put into practice. We also are reflecting and evaluating, and so connecting with various programs, various levels of government to say, you know what, you thought you were doing great. This rollout, you thought you included us, but here are the ways that our community is not feeling supported. We also are doing our own research internally in order to support advocacy, and we hope that this will highlight the way the pandemic has significantly impacted our community. So we are partnering with a great authentic partner at the University of Alberta, Dr. Maria Ospina and her research team, to really try to meld the quantitative experiences with qualitative experiences in our community. And you know, I have not shared this completely with community yet, so I have to just kind of leave that with a teaser, but this information will be coming, and it might be something that your law students are interested in, just to hear about some of the challenges that we do face. I will share one slide because I think it's particularly relevant, but also it breaks my heart. You know, we knew we had challenges pre-pandemic, and I think that's really important to remember. But the impact of COVID-19 on the quality of life for Métis Albertans, if you look at this graph, and this is just one preliminary result from our survey, it showed that 68% of our community has said that their lives have gotten worse or much worse as a result of the COVID-19 pandemic. And so I think it's important to think of, you know, as a law student, what your role could be. You know, when you are, if you are thinking about moving into Indigenous law or supporting Indigenous communities, you know, there's a story behind this quality of life. This, you know, this is not an isolated incident, and there's room to have allies to help us along this journey to ensure that we don't see these numbers if this ever happens again. I think the other thing to talk about, because it's such a jurisdictional nightmare, and I believe that my colleague Bonnie Healy is going to get into a little bit more of the jurisdictional pieces, but the vaccine prioritization, I think it's really important to note that I think we had a missed opportunity by all levels of government to include Métis Albertans in the initial stage of the vaccine rollout. I think it's great that the independent body, the National Advisory Committee on Immunization, has since provided further guidance. And with this expanded guidance, our province has included Métis folks in phase 2. And I think it's important to note that, you know, while the prioritization initially rests with the National Advisory Committee, which considers many factors, and it is, you know, seeking to have an equity approach to immunization services to reduce those health inequities. As public health authorities roll out vaccination programs across provinces, I think there is a gap in really truly understanding that equity related to access involves more than just prioritization. It involves allocation of vaccines, ensuring that vaccines are delivered in a way that considers, you know, the self-governance and self-determination of the people. So in our case, the Métis people, and recognizes kind of those historical traumas of colonization and the contemporary challenges that kind of flow from those. And I think that the Métis Nation is not immune from past and present traumas that are often associated with the health system. And this includes things like racism, stigma, and discrimination. I think we also face unique traumas with that ongoing invisibility. I can speak to my own personal experience, you know, having not grown up in a Métis culture and then really struggling to embrace that identity and find that place of acceptance. And then, you know, I'm enjoying the journey. I feel proudly Métis, but then to not see yourself included in policies and programs and services can be re-traumatizing. So I think key lessons learned is that, you know, for our community, urban Métis have not really been meaningfully included in COVID-19 responses across Canada, though I think that our advocacy efforts are starting to pay off. It is a little bit better than H1, but just kind of marginally so. They're throwing funds at us, but I still don't think they've figured out how to include us in those jurisdictional pieces. Alberta, I will give them credit. They are taking steps, but it is incredibly slow. And I think it's also important to understand the COVID-19 pandemic isn't the root cause of the challenges experienced by Métis people. It's highlighted gaps that were there prior to, and I hope that it spurs interest from all jurisdictions, be it law, be it health, be it education, to, you know, we have work to do. And I think it's important to highlight that solutions come from community and are supported by good partners. So moving forward, you know, in the field of law, there is room to grow, there is room to support. And I still think that communication remains the biggest challenge for our community. And with that, I think I'm at 16 minutes, so I'm going to let you go. I'll just leave my contact slide up there for a minute in case in a recording anybody needs to grab it, and then I'll stop sharing. So Marcy, thank you for giving me an opportunity.
Thank you for that, Reagan. I am very appreciative of you being here today and sharing your perspective with us. At this time, I will ask Bonnie Healy to open up her mic and start her screen, and she can share. I will do my best to, there we go, change the screen. Go ahead, Bonnie.
Okay, Nisto Anagoka Boyaki, Numstoto Agenai. I'm presenting today from my home community of Gana Nation. The Blood Tribe is also what my nation is known as. And I want to thank Justin and the law school for the invite to an important series of your speakers panel today. And I think I'll just jump off where Reagan finished off, and we'll touch on similar subjects and issues that the Blackfoot Confederacy had run into during the COVID, pandemic from last March. One of the first things that I did at the Blackfoot Confederacy is I pulled all of the data that we were able to compile from the Ministry of Alberta Health, from the Regional Health Survey that's housed within the Alberta First Nations Information Governance Center and FNIGC. And I was able to create a position paper with assistance from some research partners that I have with the University of Calgary to understand my population group, my vulnerable population group. And I think in order to really get a good understanding of how First Nations are identified in Canada, it was important for me to support our leadership in understanding that we needed to understand who was all in our community. And so not everybody that is registered on our membership list is going to be identified as residents of the community. So we needed to look at all the data sources that were available to us. So we have the Alberta Ministry of Health Surveillance, and that's a really good data set to start. And it identifies First Nations currently right now just through postal code. We are working on better grasping of the information that we have within the ministry. And we have jointly applied for the Indian registry within Indigenous Services Canada. And I believe that we are doing the cleanup of the data linkage. But I also pulled the the Indian registry data just to get a good understanding of the population groups that we'd be focused on. I had the ministry pull all of the information from the South Zone, from Calgary Zone, to see where everybody was living geographically. And then we had a really good understanding of my 65 plus and my vulnerable population groups. And then we went to look at a number of our homes or houses that are off reserve. And so when we started to apply for funding, we looked at the vulnerable population groups that were being challenged with food security issues, and we were able to secure some funding to help and support our off-reserve population group. The other challenge that I was faced with, and like Reagan, and I think this is where I can share my screen a bit, we pulled, I don't know if everybody can see that. So we pulled the data for the First Nations people in Alberta, and we were able to create this dashboard with the ministry, and this is available within the Alberta First Nations Information Governance Center. And you can see the total cases as of February 24th is 11,846. 785 are currently active, 75 hospitalizations, 21 are currently in ICU, 957 currently or have been hospitalized ever, and we've had 112 deaths. One of the important things that I have leadership look at is I compare the main dashboard. So this is the Alberta dashboard to date. And then I'll do a percentage as to what is the current situation. So this is a briefing note that I did for the chiefs of Blackfoot chiefs when they met with Minister Miller last week. So if we look at the current data picture of the Blackfoot Confederacy, we know that we have 970 confirmed cases, 67 were hospitalized ever, 17 in ICU, 14 currently hospitalized, and 109 active cases. This was from last week. And then I just did a percentage of what we're currently looking at. I also pulled the First Nations for all of Alberta, and then I looked at the on-reserve data, which is housed within ISK, and it's not available publicly, but it's reported on a regular basis by the medical officers of health. Then I pulled the highlights from the COVID data dashboard. So we can look at the trends and see how many First Nations are actually occupying the ICU beds. And if you look at the data that's within the ministry, so you have 48 ICU beds, 21 are currently First Nations. And so my concern is if we didn't prioritize First Nations in the vaccine rollout, then we were going to see more loss. And I'll talk about this piece in a minute. What I do want to talk about is the jurisdictional issues of legislation. So with regards to the Health Information Act and privacy legislation, when you have two systems that can't speak to each other because there's jurisdictional barriers, it's really difficult to notify First Nations on reserve health systems of a positive case. And so I knew that there was movement, really fast movement between First Nations individuals going on and off reserve. And generally, if there's unstable housing or unstable circumstances like underlying addictions, the First Nations will generally go home to isolate or choose to go home when they're sick. And so when this occurred early in April, there was an individual from my home community that got sick in Calgary. Calgary Health Zone was not able to communicate with the Blood Tribe Department of Health to notify of this individual that was not complying in, that was not complying with isolation because of unstable housing. And so they were, they came home and an outbreak had occurred. The individual was secured in isolation area that was approved by the community and supported by the community, but they were fined because they had been mixing with a number of households before this had occurred, and this resulted in the loss of life of my uncle. So this was the first First Nations death that we saw in the province. And the big barrier was due to privacy legislation, and in privacy legislation, First Nations are not recognized, and in the Health Information Act, First Nations are not recognized as active players in the health system, and so the two systems can't communicate. And this proved to be a huge barrier. One of the issues that we had faced with vaccine rollout in December was this really gives a good understanding of who we met with from provincial representation. It was explained to us, like Reagan had explained, that Metis were not part of the early phase, neither were First Nations of the rollout of the vaccine rollout. And so what had happened from the January 5th conversation is we were informed that First Nations were a priority group as identified in the National Advisory Committee on Immunization Guidelines. And so we were one of the 4 population groups that was deemed vulnerable and would be necessary to set as priority to receive the vaccine early. And so we, Dr. Hinshaw showed us the information, showed us the high rate of death risk in First Nations, and used the death risk as setting us as a priority in phase 1 of vaccine rollout. This shifted on January 6th when, and it's in the media, where 200 physicians lobbied Minister Shandro to change the priority to protecting the health system, and vaccinated all of the medical unit staff, the surgery units and the OR unit staff and the ED department. And this depleted any vaccine supply that Alberta had in the end of January, which carved out the allocated doses that were for First Nations. And when this decision was made from January 5th to February 17th, it resulted in 49 deaths. So it was about 1 to 2 deaths a day from that decision. And then when I shifted it back to the conversation as to why First Nations should be a priority, I talked about the percentage of First Nations that are now occupying the health system. So if death risk is no longer a priority and protection of the health system is, but we are the ones that are starting to occupy and flood the hospital beds. And so is protecting the health system from First Nations, or how can we turn this picture around? And the only way that I could see that we do that is we get vaccine into the First Nations communities as soon as possible. And lastly, I think, I don't want to share this great text, but I sat on an AFN COVID-19 data working group that actually fed information up to the National Advisory Committee on Immunizations. And we talked about a number of issues, but some of the 4 main objectives was to provide the context and factors of First Nations response and the vulnerability to COVID-19 pandemic, recommend a rights-based approach to responding to the pandemic, and emphasize the structural shifts required and associated resource needs that will support system changes required to not only to reduce First Nations vulnerability in the current COVID-19 pandemic, but for future pandemics and emergencies as well, and continue to support First Nations-led pandemic responses and share successes and develop recommendations that support First Nations resiliency during public health emergencies. So I won't go through this entire text, but I think it's important to really see some of the highlighted areas that we focused on. So we focused on some of the challenges and gaps with health, with housing, with child family services, some of the
speakers, which are the 65 plus. then this would be a huge concern. With education shifting to online, connectivity was a huge issue, and having the hardware of laptops or any kind of technology for the students to connect online was also a huge issue. We were not ready for that. Food security was a big issue. Water access. A lot of our First Nations community members are on cistern tanks, and because you're home and you're needing to wash a lot and wash your hands, the constant running of water, the delivery of water was no longer sustainable on a 2-week interval. It was more like either weekly or more often than that, depending on how many people you had in the house. So we talk about transportation because people could no longer share space in vehicles, I think was a big issue. And so going to the local towns or cities to get groceries started to be a problem. Connectivity I talked about, and some of the economic development and issues of have also hit us pretty hard. So I think with that, I don't know if I'm at the end of my sharing, but I hope that helped.
Thank you very much, Bonnie. I think we have a better idea of some of the unique challenges that these communities are facing. One of the perspectives that we had hoped to have join us is closer to the government, basically from the government's point of view. So we have Dr. Danielle Ben Smith, who was invited to speak today. And Zoom being what it is, she has not been able to join, although I think she's watching right now, and we're communicating with her to see if we can get her to join us as a panelist. But in the meantime, we invite anybody present to use the Q&A function at the bottom of the screen to ask any questions that you might have of Reagan or Bonnie. They can be questions to the whole panel or to individuals there. I'll start it off. Bonnie, do you see data governance as a way of, I guess, enforcing or asserting Indigenous rights, where the more control that we have over our data, the better we're able to speak for ourselves? Do you think that's true?
Absolutely. I think, you know, fairly, like maybe in the summer, Dr. Tam's office had contacted me and asked me if I had a question that I can ask the Canadian government, what would that be? And early in the pandemic, not having control of our data, not having it accurately identified, not really knowing all of the residents that were in communities, to do effective pandemic planning on evidence-based decision-making was just really difficult and challenging. So First Nations need robust surveillance infrastructure in their communities in order to do effective pandemic planning, contact tracing, outbreak management. And until we get there and recognized, you know, and respected, that our data is needing to be understood from a First Nations worldview lens. And what we're finding is governments who hold that information in their systems don't know the complexities of identification of First Nations, and so have a difficult time telling the data story or navigating through. And so First Nations really need to be the leaders in and governing their own information.
Thank you. We are joined by Dr. Danièle Ben Smith, who is not Casey Caines, but has managed to make it despite at the communication issue with time. She joins us from BC. And thank you for graciously changing your schedule to meet us here today. I have a short introduction for you. Dr. Danièle Ben Smith has been working to support Indigenous health in the Office of the Provincial Health Officer of BC since 2015, where she works alongside Dr. Bonnie Healy, the Provincial Health Officer. She provides independent advice and support to the Ministry of Health on Indigenous health issues. In support of the Ministry's strategic agenda, the Provincial Health Officer Dr. Ben Smith works in meaningful partnerships with Indigenous collectives, communities, and organizations to advance wellness and disrupt colonial practices and policies. Dr. Ben Smith is H.O. Big Animal people of the Fort Nelson First Nation in BC with French-Canadian Métis roots in the Red River Valley. Thank you for joining us, Dr. Ben Smith.
Thank you so much for having me this morning, and I do apologize for all of the technical difficulties, and thank you for the introduction. I won't reintroduce myself. Those are my people, where I'm from, and I'm very grateful to be calling in today from the territories of the Lekwungen peoples. I'm just going to quickly put a slide up, and hopefully people can see. I'm just going to get that started. Are people seeing the slides? I don't know if any of the other panelists can confirm that the technical difficulties aren't following me.
Yes, we can see them.
Awesome. Okay, that's great. So yeah, thank you so much. And thank you so much for the invitation. It was really lovely to receive Casey's invitation and to learn that we are in fact related. And it's always wonderful to meet other relatives through this type of work. So thank you so much. And thank you to the other panelists. Bonnie, it was so nice to see you. Bonnie and I met at a gathering just at the beginning of the pandemic in Toronto. And I was really grateful to hear both Reagan and Bonnie speaking about the experiences in Alberta. And I think there's a lot of similarities to what's happening here in BC, and then maybe some things that are a little bit different as well. So I just wanted to acknowledge this beautiful artwork up on the screen, which is a painting from Christy Belcourt called "Our Lives Are in the Land." And I am going to try and be very succinct and brief today. I know we've got 15 minutes. And so the things that I wanted to share is reflecting on the reality that as Indigenous peoples, we didn't come into the pandemic on equal footing. I want to share some of the high level principles that we're trying to embody within the Office of the PHO here in BC. And then provide a couple of real world examples of reconciliation in action in all of its complex, messy, and disruptive glory, which is already what the panelists have been speaking to. And I was mentioning Christy's beautiful artwork, and it's just such good medicine for me, and it really helps affirm 4 key teachings that have been reminded to me throughout the pandemic, including that self-determination and the freedom to be distinctly ourselves is really our deepest root of wellness. We are strong and resilient as Indigenous peoples, and we have these diverse, unique, sacred knowledges and wisdom about how to get through hard times. We are one, we're all connected, and COVID-19, I heard Janet Smiley and Sarah Funnell refer to it as a tricky relative, a trickster that's here to teach us things. And for me, one of the greatest ironies of COVID-19 is that while it requires us to stay physically apart, at the same time, we absolutely need to come together and work in meaningful partnership. You know, COVID-19 doesn't discriminate, but systems and structures do. And so I want to share with you an image when I kind of think about the context of why it is that we didn't come in on equal footing. I want to share this image with you, which is from our partnership with the First Nations Health Authority. And this is part of a baseline report, the Population Health and Wellness Agenda that's going to be released later this month. And this image emerged, this ecosystem image emerged when we asked ourselves 2 fundamental questions. What do we need more of to be healthy, vibrant, and self-determining? And what do we need less of? What are the things that are getting in our way? And we looked at this through a specifically First Nations lens here in BC, but I think a lot of the threads are common and they're fairly universal principles that apply to a lot of Indigenous groups and communities that I've met over the years. So Our deepest roots of wellness are really the things that make us distinctly who we are as Dene, as Metis, as Tunaha, Tlingit, Hook-A-Minam, Blackfoot. It's our language, our culture, our customs, our land, our families, our communities, our nations. We need self-determination and jurisdiction over those things to have the freedom to be ourselves. In the shallower soil on this image, we have illustrated all the different mainstream settler systems that we need to interact with in a good way to get our basic needs met. Healthcare, housing, food, education, justice, child welfare. When those systems, those settler mainstream systems, operate at a high level that is culturally safe, that's free of racism and discrimination, and when we have the self-determination and jurisdiction to be completely ourselves, so when all of those roots of wellness are well nourished, then we thrive in terms of mind, body, spirit, balance, and wellness, and that will be reflected in our health outcomes. So this image is now sort of our guiding framework as we track the health and wellness of First Nations people in BC over the next 10 years. And it really helps to make that distinction about health outcomes versus determinants of health, and also helps us for all of us, including justice and education and child welfare, to see how we're all implicated and how we all contribute to this ecosystem of wellness. So looking at that from a COVID perspective, when we think about why we came in with unequal footing, as a result of longstanding discrimination and social exclusion across all mainstream systems, not just health, many of our relatives are living in conditions where there's an increased risk of being exposed to COVID-19. We also, many of our relatives, again, because of that undernourishment of our roots of wellness and the impacts of colonialism and the enduring racism and discrimination, many of our relatives have come into COVID bearing the burden of higher rates of chronic disease, which put them at greater risk of severe illness with COVID-19. And the part that is especially worrying to me and many others is that COVID-19 actually threatens our cultural continuity, because it's a virus that is particularly problematic or severe in the elderly. And so it threatens our elders, who are these critical connections to our language, our stories, our customs, our teachings. And so it really does threaten the essence of who we are. And so we didn't come into the pandemic on equal footing as a result of longstanding racism and discrimination, and the stakes are really high. So I want to shift gears and talk about how we've been approaching things in BC and how some policy and legal agreements are actually helping to advance Indigenous self-determination. And again, I am very mindful that I'm presenting right now the First Nations Health Authority partnership work, but we are working in close partnership as well with Métis Nation BC and BC Association of Aboriginal Friendship Centers as well, and wanting to embody that distinctions-based approach. So I think COVID-19 has created opportunities for us to advance self-determination, and this image is entitled Sharing Bioethics, and it's by Dene bioethicist Lisa Boyven, who works out of the University of Toronto. COVID-19 has illuminated these long-standing tensions between Western public health practice or mainstream public health practice and diverse Indigenous communities, organizations, and collectives in BC. And it's presenting this opportunity to disrupt and arrest colonial practices and policies through the creation of unprecedented partnerships between health systems, stakeholders, practitioners, and Indigenous rights holders. And a two-eyed seeing approach can really facilitate collaborative responses. And so this image has been an anchor for me, certainly through the pandemic, but pre-pandemic as well, because Lisa's done such a beautiful job of illuminating the distinct worldviews that are at play and deliberately de-emphasizing the dominant biomedical sphere by making it smaller and reminding us how critical it is that we stay vigilant around creating spaces for First Nations, Métis, and Inuit ways of knowing and being. And that's an area we've really struggled in BC. We've got a small community of Inuit people, and we don't have sort of that governance structure here in BC to have a fulsome relationship yet, but something that we acknowledge and we want to continue working on. So quickly, I want to share with you a couple of, as I said, messy, complex stories about what this has looked like in the real world of COVID in BC. So there were some very high profile media stories about First Nations leaders advocating for more access to information. So we actually do have an established notification pathway with the First Nations Health Authority as the designated First Nations data stewards here in the province. So there is a notification pathway for all First Nations COVID-19 cases, and their communities and leadership are notified. In the summer, there was a coalition of nations that initiated a nation-to-nation table to discuss pandemic response and planning. And one topic that came up as a focus was information, not about First Nations, but about cases of COVID-19 in proximate or neighboring communities to First Nations. So leaders said, we really need to know when there are cases in community X, Y, or Z, because that's where our members go to get groceries, get gas, and we want to be informed so that we can give them appropriate warning and guidance when there are COVID-19 cases. So this unfortunately was a very challenging conversation to have. It was very difficult to focus on that relational approach because it was set up through a Western legal framework. And it was the first time that I had been engaged in conversations primarily talking through lawyers. And it was just very, very new to me and challenging. And due to the complexity of the data collection and reporting that happens around COVID-19, we were really hoping to be able to have a more free-flowing conversation back and forth about what was actually possible and what was actually, what the data was actually useful for. And there is sort of this idea out there that, that there's an all-knowing being about COVID-19 data, and that any one moment somebody should be able to push a button and spit out, the exact location of people with COVID-19. But that is definitely not the reality. And so it was challenging to get that across. Anyway, in the end, the preamble to the final agreements, and we do now have information sharing agreements with a number of the nations. In the preamble, it's very explicit that the nations did not feel that the final agreement met their original requests, and it's not satisfactory from their perspective. And there's also a piece that describes how on both sides the experience was quite long and frustrating. And my hope is that we can use this agreement and the process that we took as a benchmark, and certainly not hold it up as an example of, wow, this was absolutely, a perfect example of reconciliation in action, because it wasn't. And we all acknowledged that and honored that in the preamble to the agreements. But I do hope that it's going to allow us to continue to have this really important conversation about information sharing through the rest of the pandemic and beyond, and be able to look back at this initial agreement as a benchmark. And I'm hopeful that in 5, 10, 15 years, we'll be able to look back and say, wow, we've learned a lot, we've come a long way, and we should feel good about that. I know I'm running short on time, but I do want to quickly share these 5 sites of institutional racism, and I'll share the slides with you so you can all have the source and citation. we used these 5 sites of institutional racism to actually arrest racism and discrimination in policy. So Emergency Management BC in the springtime had a policy around reimbursements for security checkpoints that required the medical health officer to order the closure for a nation to be reimbursed. So many of our nations went into a self-imposed lockdown during that first wave of the pandemic. Those were decisions that were self-determined by the leadership as their response to the pandemic. They did not align with Western public health practice, and that has to do with the differences in core values again. Western public health practice really uses restriction of personal movement as a last resort because it really privileges individual liberties and libertarianism. And we know as Indigenous peoples that we often privilege the health and wellness of the collective as superseding any one person's importance. And so there was a tension, right? So it certainly required Indigenous, this was an Indigenous First Nations policy that was enacted, and it required a non-Indigenous medical health officer to approve it. So we got there using those sites of racism and pointing to and saying, this is an example of tyranny of the majority. We're including Western biomedical evidence and we're excluding First Nations evidence. And that did lead to change. It took several months. This policy is from November. The conversation started in May, but we did get to the point where the province no longer requires medical health officers to authorize security checkpoints. So I think that was a small win, and these days I feel like I want to celebrate every small movement forward. I will just end with these beautiful words from Margot Greenwood, who is the VP of Indigenous Health and Northern Health Authority, and I'm so grateful to her for her mentorship and friendship. And in the early days of the pandemic, when I was feeling so overwhelmed, and I'm still feeling that, of how to navigate these tensions in a good way, Margot sent me these words, and she said, the fundamental premise here is that different systems of knowledge exist in the world. The oppression of one over the other is what we face on a daily basis. This oppression is held in place by societal beliefs, structures, policies, and practices. Ethical space brings knowledge from multiple sources together to create something new and relevant to contemporary situations, ever evolving, ever changing, just like the elders teach us. So I was so grateful to be invited today because I do think those deepest roots of wellness do absolutely rely on shifts in legislation and self-determination and jurisdiction. And so I think each and every one of you that is pursuing a career in law is going to have this important role to play in terms of how we bring this ecosystem of health and wellness for Indigenous peoples back into its natural state of balance. I'm so grateful to be in this space and doing this work with all of you, even though it is hard and brings about a lot of tear and emotions. I am very grateful for the gift of it. And thank you all for your patience as I grappled with some of those technical difficulties today. Masicho, haichka.
Thank you so much. We are at the end of our time that we've allotted. Anyone that needs to move on and carry on with your day, you're welcome to do so. For our speakers, if you're willing to, we can open up the floor for a few questions. If we're respectful of your time, of course, if you need to go, then that's all right too. I thought it was really.
I'm so sorry, Justin. I am going to have to go because I actually was supposed to be speaking at another thing, but I bumped it. So I'm going to leave for that. And I'm so sorry, but it was so nice to see all of you. And I wish you all the best.
We're so appreciative of your time. Thank you. Hi.
Bye.
Great. So I thought it was really fascinating how each of you kept coming back to information and privacy and governance over communities' information. One of the implications of this is that for us to be in control of our destiny, we not only need to assert ourselves, but we also need to be good neighbors. The issue of negotiation and advocacy kept coming up. One of the issues of around information that we have a question about was that, and we had Athena G ask, how have First Nations and Métis made use of contact tracing on and off the reserves? If one of you would like to field that.
I think we probably have very different experiences. So maybe I'll take it from the Métis perspective. So the Métis access their health services through provincial services. So we do not have our own health authority at this time. We do not have the capacity or the mandate to do contact tracing. We have been asked to essentially trust in our health service provider in order to make that happen. And so how have we been making use of it? We have been connecting with the province and Alberta Health Services to let them know when things are not working and to outline our expectations. But the information is not shared with us. In part, we have a very small community. And so we don't need to know who has COVID specifically. We just need to know that the contract tracing system is working. But we have not had any conversations as to how we would even take over that role, because the reality is at this time, we have an information sharing agreement that allows us to have certain specific data. We actually do not, in our role, have the ability to take any sort of health information. So we're not covered under the Health Information Act. And so it's not actually something that the MNA can look into at this time without further conversation with the province. And often the challenge is that, out of sight, out of mind. So this conversation is a great one to have, and it should continue beyond the pandemic to ensure that we get what we need. But the reality is this pandemic has been so reactive, right? We hear something and we have so many people hurting that you have to trust that all the pieces are coming together. And often it's, hindsight, okay, well, I need to tell Alberta Health Services that this didn't work for our community. It wasn't safe in this manner. We had these experiences in hope to build it up. And then hopefully once the pandemic settles down, when we're not dealing with, people who are sick, people who are not meeting their necessities of daily living, people who are trying to access all the information related to vaccines, when all of that settles, we'll be able to have better conversations about how we integrate ourselves into some of those bigger systems, because the reality was that those conversations did not happen in earnest prior to the pandemic. So that's where what the Métis experience is like. I assume it will be different for Bonnie.
And I can only speak to the Blackfoot nations that I work with. And I'm really, really fortunate. I've got a fairly large population, so this could have been really scary in the beginning. And my home community is one of the largest land-based and population-based in Canada. We have a little over 13,000 enrolled members. So that's not counting those married into the community or those that are Bill C-31 or Sharon MacGyver individuals. So it can be even much higher than that. And Siksika Nation is fairly close to the city, about an hour away. And Piikani Nation is kind of in the Pincher Creek area, Crow's Nest Pass type area. Had really interesting approaches. The Blood Tribe took it from a census-based approach, and so they did household testing of every man, woman, and child in the community twice. Early in April when they had their first outbreak, and they did it again in the summer months in preparation to their annual Sundance ceremonies, which they had. They had over 7,000 people attend that camp. And from July, end of July, there was 0 cases in the Blood Tribe from July until about early November. And then Piikani didn't actually see any cases at all from the start of the pandemic until the end. Until most recently just before Christmas in December. And they really treated it locking down their community. They had restrictions. They were paying attention to Wuhan. in December. So they actually ordered all their PPE in December. And then they locked down their community really early before even any Alberta announcements came into place. They also did household testing. Siksika also took on the challenge of running testing. And I had two of my relatives actually go through their testing site, and they got their results back in less than 24 hours. So the efficiency of how Siksika Health was running the testing sites was incredible. Both Blood Tribe and Siksika and have tested well over 15,000 individuals, and Piikani Nation has also tested a large volume of individuals as well. And so taking control of the testing, and then really taking control of the communication, and having the community, the elders and youth involved in the messaging, and protecting the community as a collective, and protecting the elders as a collective. Having loss of life really impacted the community, and losing some of those elders that were very near and dear to us in the communities really was a powerful message that we're all in it together, and that we're here to protect each other. And so what we did when we had community members that became sick, we supported them all, whether they lived on or off reserve, in their isolation. We checked on them, we brought them groceries, we brought them essential supplies. We stayed in regular contact with them. And that proved to be very effective in containing the outbreaks that we did experience during the pandemic.
Thank you, Bonnie. I get a real sense of how having a tight-knit community is a real advantage in those kinds of situations. There are a lot of people in urban areas who live alone, and you know, if they get sick, it's a tough haul. We are running a ways over time, and I want to be respectful of our attendees. Thank you, everybody, for joining us today. I hope that you can make time over the lunch hours for the next week to join us for our final presentations. Again, thank you to our presenters, Reagan, Bonnie, and Dr. Ben Smith. Have a great day.
Wonderful, thank you. Have a wonderful day.
Thank you. Bye-bye.